Welcome to the Deep Dive. You're tuning in because, well, you want to get to the heart of complex stuff quickly and properly. And today, we're tackling something really fundamental. What actually makes a health outcome good? It's a question that goes way beyond just survival.
That's exactly right. Survival is, the metric we hear about most often. And look, it's obviously incredibly important, but think about this for a second.
Okay.
You would have two people, same serious illness. One gets really aggressive treatment, lives maybe 5 years longer, but those years, they might be filled with just debilitating pain, unable to really live the other person. Maybe they choose something less invasive. They live 4 years longer, perhaps, but with a really high quality of life, spending real time with family, doing things they love.
Yeah.
Which one of those is the truly good outcome?
That scenario just hits it home immediately, doesn't it?
Yeah.
It forces you to question if just living longer is the only thing we should measure. So that's our mission today on this deep dive. We really want to unpack what good means in health outcomes, going beyond just the survival numbers to, explore all the other things that matter to our well-being, what we actually value.
And just to be absolutely clear, survival is crucial. We can't overstate that.
Yeah.
The strides we've made in extending life, think childhood cancers or managing heart attacks, that's amazing progress.
Absolutely should be celebrated.
Definitely. And metrics like 5-year survival rates, they give us vital info for checking if treatments work, for tracking how we're doing against big diseases.
For sure. Those numbers give a critical kind of high-level view. But okay, here's where it gets tricky and maybe a bit misleading if we only look at that.
Right.
It's like judging a car just by its top speed. You miss comfort, fuel economy, safety, everything else that makes it a good car.
That's a perfect analogy. Focusing only on survival often means we ignore the quality of those extra years. Like we said, more years aren't automatically better if they're full of suffering. And what's really interesting is sometimes pushing too hard just to extend life can actually take away from other things patients themselves care about more. For someone with an advanced illness, maybe independence or dignity feels more important than just a few more months.
That makes sense. Those survival stats, they don't tell you if someone can go back to work or just look after themselves day to day.
Exactly.
Or, stay involved with their friends and family. That's the stuff life's made of. And sometimes the goals that really matter don't even connect directly to living longer. Like someone with really bad arthritis. Their main goal might just be less pain, being able to move better, even if it doesn't change their overall lifespan one bit.
Precisely. Or think about severe emphysema or advanced Parkinson's. Often the focus shifts to managing those really tough symptoms, improving daily function, not just prolonging life at all costs.
So outcomes like being less breathless or having better motor control, those become the key wins.
They do. And it makes you ask, are the standard metrics we usually track always capturing what truly matters to the person living with the condition?
And it's not just chronic stuff either, is it?
Yeah.
Even treatments that do extend life, like some really intensive cancer therapies.
Yeah.
They can leave people with serious long-term side effects. Chronic fatigue, nerve damage, what they call chemo brain, cognitive issues.
Right.
A survival number just doesn't show you that lived reality, that day-to-day impact.
Not at all.
Okay, so if just living longer isn't enough, what are the other crucial parts of a good health outcome?
Well, this is where health services research has really moved forward. There's a growing agreement that we need a much broader view. And a huge piece of that is quality of life. QL.
QL, yeah, we hear that term a lot. But what does it actually mean in a health context? What's included?
Fundamentally, it's about how someone sees their own position in life, within their culture, their values, relative to their own goals and expectations. It's really subjective. And we usually break it down into a few key areas. There's physical well-being, so pain, energy levels, sleep, symptoms, emotional well-being, mood, anxiety, that sort of thing, social well-being, relationships, support, being involved, and functional well-being, basically. Can you do your daily stuff?
Right, so it's very personal.
Yeah.
How on earth do we measure something like that consistently?
Great question. That's where patient-reported outcome measures, PROMs, come in. They're basically questionnaires filled out by the patient.
So direct from the source, no filter.
Exactly. No clinician interpretation. Tools like the SF-36 or EQ-5D ask about things like performing activities, pain levels, mood. And what's really telling is studies show a link between poor QL scores from patients and, say, ending up back in the hospital sooner.
Wow, okay. So the patient's own assessment really matters clinically. Can you give us a practical example of why PROMs are so important?
Sure. Take localized prostate cancer. You might have different treatments, surgery, radiation, maybe just active monitoring.
Right.
Long-term survival rates might look pretty similar across the board, but the side effects can be vastly different. One type of surgery might have a higher risk of, say, incontinence or erectile dysfunction than another approach.
Things that really impact daily life?
Hugely impact quality of life. PROMs let us actually measure these differences based on what patients report. That gives people vital information to make choices that fit their priorities. What trade-offs are they willing to make?
So it's empowering patients to choose based on what good looks like for them, beyond just, is the cancer gone?
Exactly. Which brings us neatly to another related idea: patient-reported outcomes and experience, PROs and PREs.
Okay, PROs and PREs, how's that different?
It builds on QL. PROs, as we said, are about the health status the patient reports. PREs, patient-reported experience measures, are about how they felt about the care they received.
So the journey itself, not just the destination.
Precisely. PREMs ask things like, did you feel treated with dignity? Were you involved in decisions? Was your pain managed well? Did you feel heard?
That seems crucial.
It really is. And interestingly, research suggests that when patients report positive experiences feeling respected, listened to COBIDI, they're actually more likely to stick with their treatment plans, follow through with meds, lifestyle changes, all that.
That makes total sense. You could have a great clinical result, but if the experience was awful...
It taints the whole thing, absolutely. And the flip side is true too. Good communication, empathy, real shared decision-making that can massively boost how someone feels about their outcome, even if things are medically tough.
So things like the Choosing Wisely campaign fit here, trying to make sure care matches patient goals.
Exactly that. It's about aligning the what we do with what matters to you.
Okay. Now, you also mentioned functional status and independence earlier. Let's dig into that.
Right. Functional status is basically your ability to do everyday activities. We often talk about ADL's activities of daily living.
Like basic self-care.
Yeah, bathing, dressing, eating, using the toilet. And then there are IADL's instrumental activities of daily living. These are a bit more complex, needed for living independently in the community.
Things like managing money, shopping.
Exactly. Cooking, transportation, managing medications, and tying this back to our main question for many people, just being able to do these things again or keep doing them, even if they aren't fully cured. That is a profoundly good outcome.
I can absolutely see that. Regaining that independence must feel huge.
It's massive. Losing functional independence, that can really hammer quality of life, puts more strain on caregivers, often leads to higher healthcare costs too.
So treatments and rehab programs really need to focus on maintaining or improving function.
Yes. When they do, that's often what patients and families define as success, as a truly good result, even if the underlying condition is still there.
We've talked a lot about the individual perspective. How does this scale up? What about the sort of societal view of good health outcomes?
That's a really important angle, especially for policy and research. One big area is the economic impact. Good health outcomes often mean lower long-term health care costs, fewer complications, fewer hospital stays.
Makes sense.
Plus, a healthier population generally means more people working, being productive, paying taxes, less reliance on disability support.
So good health isn't just personal, it actually boosts the economy.
It has significant ripple effects, yes. So interventions that improve individual health and have positive economic effects. From a societal view, those are very good outcomes indeed.
Okay. What else from a societal angle?
Well, then there's the huge issue of equity and access. We have to ask, are good health outcomes available fairly to everyone, regardless of income, race, where they live?
Critical question.
Because a system that works great for some but not others, it's not really achieving its potential, is it? A good societal outcome has to involve reducing those health gaps, ensuring everyone has a fair shot at the best possible health.
Which means thinking about access to care, culturally sensitive services, tackling those social determinants of health.
All of that. Then there are the broader public health benefits. Many things we do in healthcare help more than just the person receiving the treatment.
Like vaccines.
Vaccines are the classic example. You get protected, but you also help protect vulnerable people around you through herd immunity.
Right, that collective benefit.
And that principle applies elsewhere too. Things that reduce infectious disease spread, initiatives for community mental health, creating healthier environments like clean air and water. The overall health and resilience of the whole community is a vital outcome.
Okay, so individual, economic, equity, public health, anything else?
One final thought, maybe less of a direct outcome, but still crucial, especially now with healthcare resources stretched thin, is sustainability.
Uh, can we keep doing it?
Pretty much. An intervention might give great results for individuals and society now, but if it's incredibly expensive or harms the environment, is it truly sustainable long term?
Good point. So a really good outcome should ideally be achievable without bankrupting the system or damaging the planet for the future.
Ideally, yes. It adds another layer of complexity.
Wow. So it's this incredibly complex picture. Individual feelings, quality of life, practical function, economics, fairness, public good, sustainability. Trying to integrate all that must be tough.
It really is. And sometimes these things are in tension, aren't they? Extending life versus maintaining quality of life. What's best for one person versus the cost to the system?
There's no single magic formula then.
No, there isn't. The key, though, is to actually acknowledge all these different dimensions are important and move towards a system that explicitly values them. That's really the idea behind value-based healthcare.
Trying to get the best outcomes that matter to patients relative to the cost.
Exactly. And achieving that means we, healthcare systems, clinicians, researchers, need to be actively collecting data on these broader outcomes, not just the traditional lab results or survival rates.
And crucially, it sounds like talking to patients.
Absolutely fundamental. Engaging patients in defining what outcomes matter most to them. That whole process of shared decision-making where clinicians and patients work together using evidence and the patient's values.
Because good can look really different depending on who you ask.
Precisely.
Okay, so wrapping this up, the main takeaway seems to be that defining a good health outcome is way more complex, more human than just did they survive. It really includes quality of life, their experience during care, their ability to function day to day, and even these wider societal impacts.
That sums it up well. We're definitely seeing this important shift in healthcare,
Right.
moving towards a more holistic, more patient-centered view. It really comes down to listening.
Listening to patients, measuring what they value.
And designing systems that can actually respond to those diverse needs.
It kind of reframes the whole goal, doesn't it?
Huh.
From simply, can we treat this disease, to something more like, can we genuinely improve this person's life in all the ways that are meaningful to them?
That's a powerful way to put it. It is a profound shift, and it's ongoing.
So maybe a final thought for everyone listening. What does a good health outcome actually mean to you?
Yeah, that's the question it's worth thinking about, and it's a conversation we all need to be part of as we keep working towards, hopefully, a healthcare system that truly values every dimension of well-being.